There are some things I keep thinking about, even now. Little moments that didn't seem like anything at the time, but in retrospect, they were the early signs. Paraneoplastic symptoms, cancer symptoms, the ones we learn about as doctors: weight loss, night sweats, breathlessness, but somehow miss when they appear in the people we love. This is not something easy for me to say, to recall, but here it is. I have to do it. My mother was always overweight. We wanted her to lose some weight. So when she started losing weight, we were happy for her, genuinely happy. We thought that she was finally doing well. Little did I realize that this was something more sinister. Then the night sweats came. She's always been someone who's disliked the cold. She's always felt the cold in winter. So she wraps up. She had the tendency to sweat easily all her life. So when she mentioned this about the night sweats, even drenching night sweats, it didn't arouse any suspicion in me. To me, it was just another one of her usual patterns, part of her normal life. And this is the problem with doctors, my secret fear. Problem with doctors and their family members. We hear symptoms mixed onto everyday conversations all the time with friends, with family. But we're not in the frame of mind as doctors. When we are with family, our guard lowers, our diagnostic mind rests. We slip into normal life. We hear complaints as family complaints, not as medical ones. We simply listen as a son, not as a doctor. And I was the eldest son. No, and I am the eldest son. I was not wearing my doctor hat. I wasn't alert to the things that now looking back feels glaring to me. I wasn't listening with my clinical mind. I was listening as a child of a parent, as a son of a parent who has always been like this. Most of those early symptoms, the weight loss, the sweats, the night sweats, the breathlessness, were happening throughout 2021. And by December 2021, she received the diagnosis of advanced lung cancer. I'm still completely unclear about the exact timeline anymore. Things blur. Sometimes memory softens, sometimes it sharpens, but it's unpredictable. That's what a difficult period in your life does to you. It distorts time. Things happen quickly sometimes, and at other times they happen slowly, and you replay that in your mind as a movie, as a film, short clips here and there, some and often most disturbing. And maybe that's the part that hurts quietly. Not so much the guilt, but there is some, I guess, but a private pain. A doctor who didn't recognize cancer because he was busy being a son. This is the beginning of my story. A beginning that I didn't know was a beginning. It's like a memoir, something that I had to say, something I had to express. And even now, 2 or 3 years later, I still think about it from time to time with a struggle, not with ease, with a struggle. My parents were starting to get home help. They were getting old. And like any normal person, my father was refusing, my mother was unhappy about it. The idea of being showered by someone else is not very acceptable. But my father's dementia was progressing, and we all knew that. We had to plan ahead for the day home services would become inadequate, when advanced care would be needed, especially for my father. And my mother was aging and she had her own physical needs. And she was declining as well. So she was simply not coping, not managing everything on her own, especially with my father deteriorating as well. After a few years of persuading, and after she reached the end of a tether, they finally agreed to move into a retirement village, somewhere with more help, somewhere that felt safer for them. But everything became chaotic because just as we prepared for the move, my mother's diagnosis came. Before the diagnosis, she was packing furiously, organizing the cupboards, sorting out things, putting them into boxes in order, and listing them, everything. Doing it as if it was normal, nothing was wrong. She was moving house while harboring an advanced cancer that we didn't know about. So they settled into the new place, and her therapy started soon after, just before Christmas in December 2021. When we celebrated her 84th birthday in October 2021, little did we realize that it would be her last. Throughout early 2022, her symptoms worsened quickly. The bone pain became more persistent under her rib cage, her breathlessness got worse, and the discomfort simply grew. There is immunotherapy for lung cancer now, and some types do respond remarkably well, just like the very effective duotherapy for advanced melanoma. But my mother's cancer did not have the marker that predicts a good response. She did not get a good response. Her type did not benefit from the new treatments. We also considered local radiotherapy for the pain, but it didn't help. We considered radiotherapy to the main tumor in her lung, but its location made it unsuitable. Radiation would have worsened things because of the inflammation around the windpipes. So, when the immunotherapy failed and the tumor progressed, the treatment options narrowed. We decided to accept palliative care rather than pursue treatments that showed no signs of working. Home palliative care was organized, but it was short lived. My mother kept bouncing back to the hospital. She was afraid of being alone with my father, who was of little help to her. She had panic attacks. The fear, the pain, the breathlessness all mixed up together, spiraling and sending her back to hospital. She wasn't coping. Yeah, she needed hospital level palliative care for her symptoms, her anxiety, her frailty, and her inability to mobilize safely. Things progressed rapidly, and in April 2022, she passed away. Only a few months after her diagnosis, which was December 2021. It was rapid, it was quite sudden. Even though we had seen the deterioration, it still felt sudden. That period, the rapid evolution or devolution, was confronting. As a family, as a son, and as a doctor myself. This memory isn't going to wrap up itself neatly. Isn't heading towards a tidy ending. It will stop, it will start, as memories do, as emotions allow, as I need to breathe. And I think I'll stop here for now, though there are many more angles to this difficult period that I experienced. And I will return to them when I'm ready.